As we age, the risk of developing chronic health conditions like heart disease, high blood pressure, and diabetes increases significantly. For seniors, especially those over the age of 60, it's crucial to monitor these health markers regularly to detect early warning signs, manage conditions effectively, and prevent serious complications. Here's a breakdown of how often seniors should check each of these key health concerns. 1. Heart disease. Heart disease remains one of the most significant health threats facing seniors today, especially those over the age of 60. Even if you feel healthy and don't notice any obvious symptoms, heart-related issues can develop silently and progress without warning. That's why regular monitoring is critical. It's not just about reacting when something feels wrong. It's about proactively managing your long-term health and staying ahead of potential problems before they become serious. Annual physical exams are a must and should always include a thorough cardiovascular checkup. This typically involves listening to your heart and lungs, checking for swelling in the legs or ankles, and reviewing any symptoms such as shortness of breath, fatigue, or chest discomfort. These signs, while sometimes subtle, can indicate underlying problems with heart function or circulation. In addition to the basic exam, seniors should have their cholesterol levels checked through a lipid panel every 4 to 6 years if they're in good health. However, if there's a family history of heart disease, elevated cholesterol, or other risk factors such as obesity, high blood pressure, or diabetes, these tests should be done more frequently, at least once a year or even twice a year, depending on your doctor's recommendation. Electrocardiograms, ECGs, may also be recommended to assess electrical activity in the heart. This is especially important if you experience symptoms like dizziness, irregular heartbeat, or if you're at high risk due to personal or family medical history. For some individuals, echocardiograms or stress tests might be necessary, particularly when symptoms are present or if there's concern about how well the heart is functioning during physical activity. But beyond the tests, prevention is key. Seniors should adopt a heart-healthy lifestyle, beginning with a balanced diet low in saturated fats and sodium, and rich in fruits, vegetables, and fiber. Regular physical activity, such as walking, swimming, or yoga, can strengthen the heart and improve circulation. Smoking should be avoided at all costs, and alcohol intake should be limited to moderate levels. Equally important is stress management. Practicing relaxation techniques like meditation or deep breathing can significantly reduce the strain on the heart. By taking these proactive steps and committing to routine checkups, seniors can greatly improve their quality of life and reduce the risks associated with heart disease. 2. Blood pressure. High blood pressure, also known as hypertension, is one of the most common yet silent health issues affecting seniors. Often called the silent killer, it typically presents no symptoms, yet it can lead to serious complications such as heart attacks, strokes, kidney damage, and cognitive decline if left unchecked. That's why regular monitoring and lifestyle adjustments are crucial. For healthy seniors without a prior diagnosis of hypertension, checking blood pressure at least once every 6 months is generally recommended. However, if you've already been diagnosed with high blood pressure, or if you're taking medication to manage it, your doctor may advise monthly or even more frequent checks. In addition to clinic visits, monitoring your blood pressure at home using an automated cuff is highly beneficial. Home readings provide a more complete picture of your condition, helping both you and your healthcare provider spot trends, evaluate how well your treatment is working, and make necessary adjustments promptly. To manage blood pressure effectively, dietary changes are essential. Reducing salt intake is a major step, as sodium contributes significantly to increased blood pressure levels. In contrast, potassium-rich foods like bananas, sweet potatoes, avocados, and leafy greens can help balance the body's sodium levels and ease the pressure on your arteries. Maintaining a healthy weight is equally important. Excess weight forces your heart to work harder, which can elevate blood pressure over time. Regular physical activity, such as walking, swimming, or Tai Chi, not only helps manage weight, but also strengthens the heart. Limiting alcohol and quitting smoking further reduce cardiovascular strain. Lastly, take your prescribed medications exactly as directed and attend all follow-up appointments. Staying consistent with treatment, monitoring, and healthy lifestyle choices will help you control your blood pressure and prevent future health complications. 3. Diabetes type 2. Type 2 diabetes is increasingly common among seniors and can quietly progress without noticeable symptoms until complications arise. As we age, the body's ability to regulate blood sugar often declines due to factors such as reduced physical activity, loss of muscle mass, and dietary changes. Unfortunately, many older adults don't realize they have diabetes until they develop serious issues like fatigue, blurred vision, or frequent infections. Early detection is essential to prevent complications such as kidney damage, nerve issues, heart disease, and vision loss. Therefore, regular screening and proactive lifestyle management are key to maintaining health and quality of life in later years. For adults over 65, a fasting blood sugar or hemoglobin A1C test should be done at least once a year. These tests measure average blood sugar levels and can detect prediabetes or diabetes before symptoms appear. For seniors already diagnosed with diabetes or those at high risk, doctors may recommend testing every 3 to 6 months. Self-monitoring at home using a glucometer may also be necessary on a daily or weekly basis depending on the treatment plan. This allows both patients and healthcare providers to track blood sugar trends and make timely adjustments to medication or diet. To better manage or prevent diabetes, seniors should adopt a lifestyle focused on nutrition and movement. Prioritize a balanced diet that includes fiber-rich whole grains, leafy greens, lean protein, and healthy fats. Avoid sugary drinks, processed snacks, and foods high in refined carbohydrates. Regular physical activity, such as walking, swimming, or light resistance training, can greatly enhance insulin sensitivity and help control blood sugar. Keeping a healthy weight is also critical, as even modest weight loss can improve glucose regulation. Lastly, staying hydrated, getting enough sleep, and noting early signs like fatigue or increased urination can help detect issues early. By making these proactive changes, seniors can significantly reduce the risk of diabetes-related complications and maintain independence and vitality as they age. Final thoughts. Prevention and early detection are key to managing age-related health conditions. Regular screenings, lifestyle changes, and staying informed about your numbers, blood pressure, glucose levels, cholesterol, can help you live a longer, healthier, and more active life. If you're unsure how often you should be checked, consult your doctor. Your checkup schedule may vary based on your personal health history and risk factors.